Welcome to Staying Safe While Working in the Community, Mini Module 4. Working alone in the community is the topic of today's module. So as we move along, we will see that we will be covering the main topic of working alone in the community. So if we look at this particular picture of what may be considered in a workplace, working in a home, take a minute to look and see what hazards do you see in this picture. So I'll give you a minute to see how many of those that you can identify, and then maybe we will look at the next one and kind of talk about some of the things we see. So there's the pet over here that the lady is holding that isn't secured. It appears in her hand here she has a cigarette, and typically, and we don't allow smoking in the home when the healthcare worker is there. We have a gun of some sort here on the couch. We have beer cans and whatnot down here on the floor. On the table, we have some needles and some alcohol bottles. The home care worker has some type of lanyard or necklace or something on that their person's grabbing. And then we see the mat is turned up there by the wheelchair. And then there's a bat or something that could be used as a weapon over here. So some would say that's a lot going on, but those of you that work in the community know that you could come across one or many of these items in a community, in any home at any time. So when we think about working alone in the community, working alone can be defined as working in a circumstance where assistance may not be readily available to the worker. So under this definition, many health and community service workers in Nova Scotia do work alone as part of their normal day-to-day working duties. So Nova Scotia does not currently have a specific working alone regulation. This does not mean that the hazard of working alone can be ignored. In fact, the Occupational Health and Safety Division of the Nova Scotia Labour and Advanced Education has stated that employers need to have specific procedures and safeguards for working alone. And while working alone is a concern for all health and community service workplace, the risks are greatest for staff who are working in homes of the patients or clients. So we need to consider the home of the client poses a unique health and safety challenges for home care and community service organizations and workers. Unlike a traditional workplace, it can be very difficult to control the hazards and control the risks for workers providing care in these homes. And although it's difficult to control them, it doesn't mean that they can't be controlled. And if there's situations that arise, then the worker needs to take themselves out of that situation. So employers and workers both need to understand how they can both separately and by working closely together reduce the risk of working alone. Employers need to have specific procedures and safeguards for working alone. And many of our workers today do have their own BlackBerries or cell phones that they have with them as an added safety or communication device that allows people to get connected with their organization more quickly. But we have to consider that there still are areas in this province that doesn't have cell coverage. So how do you ensure and know and follow the procedures and make sure you have all the safeguards in place? When workers are required to work alone, their employer needs to establish a working alone policy and provide training on these policies. The policy should address such things as the frequency of contact with the supervisor, the requirement for a first aid certification for those that are working alone, and that the workers know that they can take action by getting themselves out of this situation if they feel their health and safety is threatened. And then there needs to be a process for investigating and addressing workers' concerns. So when you're working alone in the community, workers need to take time to identify hazards and assess the situation each and every time the visit is made to the home. So have things changed? Are there people now currently in the home that weren't before? Are there weapons or other things that could put them at risk? Are they not complying with smoking and dog policies or animal policies? Workers should have and fill out safety checklists as soon as they get to the client's home if that's part of your procedure. So although the working alone section module here is quite brief, it is a large risk and concern and something that we need to take seriously. In doing those assessments, ensuring that you understand what the hazards are in the workplace and that you're following the procedures is quite important. So now that you've watched mini module 4, please complete the form and answer the questions, and then you can then move on to module number 5. Thank you.